big data analysis is the way that things are going to be done. Now that we have the computing power and we have storage is very cheap, this is, we're going to be expected to use all the data that's available to us without having to go to separate research projects where possible, because instead of having to look at a small portion of the population, if we have the data we can look at the entire population. So this changes the nature of the research that you'll be doing.
Certainly the visualization program allows you to see things that you don't necessarily see before. The heat maps allows you to see relationships such as the lipid profiles compared to the HbA1 levels and the effects on death, mortality rates if you like, as well as that on comorbidities such as amputations and visual impairment. There's variation in how that responds. It's interesting to see how we can take that forwards. In terms of predictive analytics, they too are survival curves, and again, because of variables inputting, we can see how changes on them can change the survival curve. That might help patients improving their compliance as well as improving our development in terms of treatment for the future. It has potential for both. For the researchers, you can, as I said earlier, use heat maps to see the variables you didn't notice before, but more significantly in terms of planning, there's a population pyramid within the EGLI platform that allows you to see the effects in terms of comorbidity in each patient cohort. That way you can plan your study targeting the specific cohorts rather than use a shotgun approach. Therefore, you could limit the number of patient recruitment, yet get the same meaningful result afterwards. It can. Basically it is an analytics program with database functionality and sorting out. Anyone who's got a disease entity where they can capture data can utilize it. Anyone who's got statistical advice or has some general basic knowledge of significance and use it, and if not, then as an organisation we're more than happy to help supply the knowledge and know-how for them to analyse their own data. And then once you start looking at outcomes and the interrelationship between the disease processes, then you're in a better position to manage the illness and improve patient care.
If you can assess European health projects, so the General Data Protection Regulation is intended so that people can have better access to all sorts of data, but that includes health data and that it's more portable. So they will, for example, be able to move between different healthcare systems, and as part of portability of services, you want people to be able to compare health care between different hospitals in even different countries. So that's one thing, is it will empower consumers if we have that sort of system. And so, as well as system assurance, and of course you've got development in various areas, so you'll be able to break down people. So stratified medicine, you want to be able to look at all the differences within a population so that you can give people the treatment that's likely to work best. So that would be the two things really: customer empowerment, patient empowerment, and also stratified medicine.